My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
Hi, Amber Tresca. I'm asking a question because I'm one half of IBD Moms with my friend and frequent traveling partner who is not traveling with us right now, Brooke Abbott, also known as the Crazy Creole Mommy. And I'm asking this question because I'm a mother. I have a 9-year-old and an almost 12-year-old. I had both of my kids after I had J-pouch surgery, which was 20 years ago. And a question we get a lot is about delivery and vaginal delivery versus cesarean delivery. And I'm curious to know what goes into your consideration when advising your patients on how they should deliver their children.
Yeah, that's a really good question. Again, just to go on my soapbox, this is why it's important for women who are planning on having kids and they have IBD to really speak with their gastroenterologist and get in contact with obstetricians pretty early to kind of come up with a game plan. So with regard to vaginal versus cesarean delivery, there are a few ways that we kind of think about this. It really depends on the mother, obviously, and what state her inflammatory bowel disease. So if mom has really active perianal disease, so a lot of disease around the anus, maybe a lot of fistulas, maybe they've had surgeries there before, or if they've had a history of rectovaginal fistula, even if it's not active, then definitely a C-section should be considered. So if you have active disease perianally, or if you have a history of rectovaginal fistula, then a C-section should be considered because the vaginal delivery risks additional trauma to that area that can result in more fistulas down the road and just additional complications that can be difficult to treat. So C-sections recommended to bypass that risk. Now, if you've had an ileal pouch anal anastomosis, if you had something like a J-pouch, we used to think that those patients, you just go straight to C-section. But now there are some women who can safely undergo vaginal delivery. That discussion as to whether to do a C-section or vaginal delivery is really individualized. It really depends on the risk of injuring the anal sphincter and the risk of pouch dysfunction, because sometimes in patients with a J-pouch, for example, when they have a vaginal delivery, they can more easily cause trauma to the anal sphincter muscles, which can cause incontinence, or they can damage the pouch itself. But it really requires a kind of a one-to-one discussion with OB, the GI doc, and even the colorectal surgeon itself. Yeah.
Thank you for that answer. I think I failed to mention that I have a J-pouch and I had both of my children vaginally. My colorectal surgeon and my OB agreed that nobody wanted to go in there again in any way, and so we agreed on vaginal.
Yeah.
If you have a patient that you think is a good candidate for vaginal delivery, but she's maybe heard the sort of older data that we're not going by anymore, and she is feeling strongly that she would prefer to have a C-section, how would you counsel that patient?
It would have to be a consultation really with the colorectal surgeon and with OB. I think you bring up a good point. The more times we go and do surgery in the abdomen, the higher the likelihood that there's going to be a lot of adhesions, a lot of scar tissue that can make a C-section, which is typically a pretty darn quick surgery, make it more complicated and higher risk. So I would say that it's a discussion that would be probably a little bit more specifically outside of my realm and more a discussion with OB and colorectal surgery. I think patients should be mindful and open to all options. If their initial surgery was relatively uncomplicated, they've had vaginal deliveries in the past and there were no issues, then I would think that another vaginal delivery would likely proceed just as well. But again, there are risks. Having said that, if there are any of the other contraindications, so if they suddenly develop perianal disease in between pregnancies, or they developed a rectovaginal fistula, then it would probably be leaning more strongly on performing the C-section.
Thank you so much.